Good morning. Apologize for the dark circles under my eyes this morning. It was a long night. And we are going to talk a little bit about last night and how good of a job the BOE did to help us make it through this very challenging election cycle. So today we celebrate a well-run election here in Hamilton County, and we also hope that the presidential election will soon be resolved. Unfortunately, we also are going to be talking about the numbers. This is a COVID-19 press conference, as always, and so we are going to talk about the increasing numbers here in Hamilton County, including the death toll. And as we further go into fall and migrate indoors, we are facing an increasing threat greater than any time during the pandemic. And so, as always, I will go through the numbers. Greg Kesterman, the health commissioner, is here with us this morning. So grateful that Greg joins us every week to not only help us better understand the numbers, but also better understand the trends. But the numbers today are the positive cases in Hamilton County stand at 19,564. The increase from last week is 1,845. Our hospitalizations are up to 1,346. The increase from last week is 46. And our death count is up at 351. That's an increase of 7 from last week. We need to take a pause and rethink our approach to the pandemic. In addition to mass social distancing and hand washing, we need to seriously think about limiting the number of people we come into contact with. Indoor gatherings may seem safe because they're with friends and family, but they are now a leading cause of the spread in Hamilton County and throughout the state and throughout the country. We need to rededicate ourselves to what we know works and stop behaviors that we know don't. And we're going to have to make sacrifices both for ourselves and others to protect our safety and the safety of others. We must do this to keep the virus at bay until we get the vaccine. And when we do, we will need the voices of all of us to emphasize the importance of getting that vaccine out to everyone in our community. And we are poised to do that. Now is the time. We need to put the campaign rhetoric behind us and the politics behind us. We will talk next week about strategies for the holidays. We have to rethink how we celebrate with one another, but also keep each other safe at the same time. This is a conversation that is happening throughout the state. I was on a call last week where a bunch of county commissioners were talking about how we are messaging out. We continue to talk about the challenges and the dangers, really, of COVID-19 as people move indoors. But we recognize that we also need to talk about what can we do, right? It's not only the negative, which, we're in a bit of a crisis right now, but it's also about providing some ideas about how people can safely gather for the holidays. So Greg and I have talked about this as well. We would like to round out that conversation next week with everyone and offer some strategies for people as we move into the cold weather months. So as mentioned before, one thing that appears to be working well in Hamilton County is our democratic process. A huge thanks to the Board of Elections staff, both for the work done and for keeping everyone safe. Sherry Poland, the director, and the assistant director, Sally Crissell, along with the board members, including Gwen McFarland, the chair, and Alex Triantafilou, Caleb Fox, and Chip Gerhart, have done an outstanding job. A big thanks to all the poll workers who stepped up and helped carry out our democratic process. I don't know about you, but I saw not a lot of new faces yesterday at the polling places because some of the older folks chose not to work the polls for their own safety, and younger people stepped up into those roles. And it was really, I thought it was really heartwarming and encouraging that we have kind of moved forward now with a new group of folks to make sure these elections are fair and safe. Now that everyone at the BOE has secured our ballots, we must also remember to secure the community here in the post-election environment. So I know the mayor talked a little bit about this last week. We too are making sure that we've got things in place in a post-election environment. And so we are partnering with the Emergency Management Agency, the sheriff, CPD, the city, the county, the Board of Elections, to make sure that we're thinking this through and making sure that the community remains safe. We have, as an aside, been made aware that there is a post-election demonstration today being planned for downtown. My understanding is that is a drive-through event, but just to make people aware that that will be happening. And so we'll continue to work with the city and in the county to make sure that everybody remains safe and people have an opportunity to voice their opinions in our community. So that's what I've got. Didn't prepare long remarks for today. I knew I would be tired. And so I'm going to turn it over to Greg Kesterman, and he's going to run us through the numbers and the trends.
Thanks, Commissioner, and good morning. Over the last 7 days, we've continued to see a significant increase in the number of COVID-19 cases for Hamilton County, and hospitalizations for the region continue to increase very rapidly. There continues to be significant community spread throughout Hamilton County, so this should be a constant reminder that we need to really guard our activities to keep our families and friends safe. Remember, if you do have symptoms, there's a need to get tested. Hamilton County has really done a fantastic job of making sure there's access to testing. This slide has gotten so busy that it's really a lot of sites, and there are so many more sites that are not listed on this slide. To see all of the websites, or all of the test sites, I should say, please visit our website, hcph.org. The test sites are mapped so it's easy to find your home and understand which sites are closest and which sites are most accessible to you. If you have questions, you can always call ahead. On our website, it does have information with phone numbers and hours of operation. I recommend you do so. Remember that if you get tested and you're symptomatic, we are asking that you self-quarantine until you get those test results back. The last thing we need is somebody who is sick to not keep sick at home and to spread COVID-19 in our community. Looking at Hamilton County's cases, as mentioned by Commissioner Dreihaus, we are just seeing an explosion of activity right now. Our cases just continue to go higher and higher, and so it's really time to focus. Last week, I was on record saying that we had our worst day on record, and I was sharing that we had 175 cases in one day. That's just my team for outside of Cincinnati, Norwood, and Springdale. Unfortunately, this past Friday, our team saw 285 cases. Those are each cases that get assigned out to our contact tracers. And I can share that we've not seen much improvement over the last few days. We just continue to see a lot of work. On average, over the last 7 days, we've been assigning out, in the county, we've been seeing 244 cases per day on average, which is a significant jump. The week prior, it was 210 cases per day on average. These cases continue to come from our community and not just one source. Over the last 7 days, we did see high numbers of cases from all age groups. The largest number of positive cases was between 18 and 29-year-olds. They had 408 cases in the last 7 days alone. Unfortunately, there were also 175 new cases for those that were between the age of 70 and 90. So this can clearly drive an increase in hospitalizations, as we know these individuals are significantly at higher risk for severe illness with COVID-19. Very closely tied to cases is our reproductive value. This value has been above 1 now for over 4 weeks. Currently, we are at 1.13 and 1.14 for the 14-county region. As you know, our goal is to get this number below 1 so we can start to see the spread of COVID within our community start to decrease. Looking at hospitalizations for Hamilton County residents, which is the top graph, you can see some increases in the number of hospitalizations. It's not very alarming, but there is an increase. When you look at the 14-county region, it's very dramatic. We are seeing the number of individuals hospitalized at a higher level than we've seen at any other point in the pandemic. our hospitals are currently seeing nearly 300 patients with COVID. At the beginning of October, for reference, this number was around 80, so quite a jump. Similarly, we are seeing increases in the number of individuals within our region's intensive care unit. We were at the beginning of October around 25. We are now around 75. So our hospitals still have capacity, but we're starting to put some stresses on that capacity. So it's really important to start taking some additional action as individuals. So as I wrap up today, I did want to take a moment to give special thanks to our contact tracers. These folks are clearly on the front lines of our efforts to tamp down this pandemic, as they hold one of the keys and the very valuable tools to help us fight against COVID-19. And it really is a difficult job. Many individuals, when they pick up the phone, are happy to have information and are happy to work with the contact tracers. But I can share that some individuals are upset and don't want anything to do with our contact tracers and aren't always nice. So I really want a special thanks to go out to all the contact tracers doing this tireless work. Your work is greatly appreciated, and everyone in Hamilton County understands that this work will slow down the spread of COVID-19. So remember, please continue to mask, social distance, wash your hands. These are the best things that we have right now to slow COVID within our community. We'll continue to work together as a community, and hopefully we can make a difference in the coming weeks. Thank you.
Thank you, Greg. All right, Bridget, I think we're ready for questions.
Great. Our first question is from Ann Sanker from the Inquirer, and I believe it's for you, Greg.
Yeah.
Yes, thank you very much. That's correct, Bridget. This is for Greg. Commissioner Kesterman, first of all, good morning. And secondly,
Good morning.
How many contact tracers does Hamilton County have now, and how many more do you need? And secondly, what is the number that scares you most right now, and are we getting there?
So currently we have approximately 55 contact tracers employed. We are increasing that number. I want to say anywhere from 5 to 10 individuals. I have shared many times, we do have the ability to bring in my own team members to do contact tracing. My goal is always to keep my team doing their job and not to have to do that. So we're kind of balancing right now, but our contact tracers are busy. You know, all of these numbers are critical when I look at them. Cases are important because they tell us how much COVID there is in our community. It's a lot easier to get COVID if there's a lot of cases of COVID within our community. But, you know, at the end of the day, we want to make sure that we have the hospital system and the hospital capacity to treat folks that need care. And that's always been one of the goals throughout this pandemic. And so when I see hospitalizations in our region rising at such a rapid rate, it's very concerning. And we need to make sure that we have that capacity so that if you do become ill, we can take care of you in the appropriate way and you get the best chances to survive COVID-19.
Thank you.
You're welcome.
Our next question is for you, Greg, from Chris Wederick with the Business Courier.
Good morning, Chris.
Good morning, Greg. What do we look like in terms of going purple? Is that still a possibility this week, or do you think it's off the table at this point?
So we are guaranteed to get, if many of our metrics don't look good right now, as I just shared, if the state system kind of aligns with our metrics, at worst case, we would get on the watch list again. So at worst case tomorrow, we would have a star, which gives us a 1-week grace period before we turn purple. I'm trying to stay out of the prediction business because there are a couple metrics in the state system that are delayed in seeing data, but right now our data does not look very good here in Hamilton County.
Thank you.
You're welcome.
Our next question is for Commissioner Dreihaus from James Pilcher with Local 12.
Good morning.
Good morning. Want to talk about the results from last night. I don't know how much of a political hat you can put on, but now we noted that all 3 county commissioners are going to be women. Women picked up the sheriff's office, and they also picked up now women are in 4 of the 7 Ohio state reps from Hamilton County. Can you talk a little bit about that, and what does it mean, and how this is becoming a growing movement, at least here locally?
Yeah, we're on the cutting edge here in Hamilton County. We can't always say that, but we can on this one. So I think it's an exciting time. And what you referenced, it's interesting that that's viewed as a change. We've had 3 county commissioners, 3 women, for a while now. We also have had many women at the state rep level. The one significant change is the sheriff and some of the judges. And so, we've talked a long time, and I'm a little bit older than some of the women that I'm referring to, but we've talked a long time about having a seat at the table and making sure that the experience that we have and it's really life experience is part of the conversation when we talk about policy setting and budget setting at the county level. And so we are now in that space where women's issues, and by women's issues, I've said this before, I mean jobs, I mean housing, I mean families and safety. Those are women's issues. And so we have a certain exposure to what that means in our community, and we bring that to the table, and I think that's a huge asset. And so we will continue to do the work for the benefit of everybody that lives in Hamilton County. But I do think having women at the table lends another layer of, like I said, some of these life experiences that we have not had much of in the past, but we definitely have created that now moving forward.
Yeah, I mean, if you could follow up as well on the judges, I also noticed that there are four women common pleas court judges, including the judge that won the drug court and domestic relations, and there was another key one here, juvenile court, are all women now too. I mean, do you think that makes any difference, given they're supposed to be impartial?
Well, I think women can be impartial. I think it's just the idea that we have had a lot of elected officials in Hamilton County, not so much since I've been elected, honestly, in 16, but prior to that, there was a bit of a monolith there. And so what that does is create an experience for people where they don't have the life experience of a lot of the people that are coming in front of them, and a lot of the folks that are in need. Let's talk about the pandemic for a minute. Let's circle back. As we all know, this pandemic is impacting women in a very significant way because so many women are head of household and oftentimes single parents in this community. And when you have to balance that with educating your kid if they're learning remotely in the home, that's a tremendous challenge. And so women, I think, and we've seen this borne out in national numbers, are impacted more dramatically by this pandemic. And so that is right now example of how we need a woman's perspective to inform how we go about creating policy and responding to the needs of this community. And so you see that playing out in some of the things that we have done through rental assistance and small business assistance. Many of the folks that are being helped by that assistance are women, many men as well, but we do need to keep a keen awareness of the exaggerated impact to women. Domestic violence is another area where we know we have more cases of domestic violence right now, even though the reporting has been challenging for those women. So anyway, I just want to say that it's an opportunity, I think, for Hamilton County to move forward in a way that we haven't been able to in years past. But this is a unique time for us, and I think we need to embrace that.
Thank you.
Thank you.
Our next question is from Raven Richard with WCPO. She has an open question to whoever would like to address it.
No, I'm just Good morning.
Good morning. I know at the very beginning you guys said you'll probably think of a Thanksgiving plan or whatever sometime for next week. But is that obviously something you guys are concerned about or looking at? Because I know a lot of our cases have been due to maybe those private gatherings, things like that. So is this something that you guys may be concerned about possibly?
Yes. I think the short answer to that is yeah. Greg's nodding his head. And so just like we did for Halloween, Greg gave quite a bit of advice about how parents should handle Halloween for their kids. Then we talked about the election and how to safely vote, and we had the Board of Election folks in here. Now we're shifting to Thanksgiving and Christmas. I just had a conversation this morning on my way in with someone that was talking about how he and his family are already thinking about how to do Thanksgiving differently. My my siblings and I are having this conversation. And so I think what we want to do is not only say, yes, 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 you need to change things up and make sure that people are kept safe, but we also want to offer some ideas about what you might think about doing. And so we're going to have that conversation next week. It's something that I heard about last week as well from other county commissioners throughout the state. We're all kind of shifting into this space. And so we want to, put a positive spin on some of this and say, hey, you can still celebrate the holidays. You just have to do it differently and talk about how we do that.
All right, thank you.
Thank you.
Our next question is from Ann Saker with the Inquirer. She's a follow-up question for you, Greg.
Yes, thank you. Just to follow up either for Denise or for Greg, as you pointed out, this is sort of following up with what Raven was touching on. People are already starting to think about Thanksgiving. And I appreciate that you want a week to kind of put your ducks in a row, but can you toss out one or two of these ideas on how to celebrate as you're thinking? And should people also put themselves in the space where they need to apply this to Christmas, Hanukkah, and Kwanzaa gatherings and New Year's gatherings as well? I mean, do we need to buckle in to get through the holidays completely?
You bring together, whether it's for a birthday party, Thanksgiving, Christmas, the more families you bring together, the more risk you're taking and the more risk you're putting those other families in. So, as we see cases, I'll say, explode in Hamilton County, if you're putting families together, you are significantly increasing risk. So right now is the time to really think about what you're willing to do. If you're insisting this year that you want to have a Thanksgiving because so much has changed, maybe limit the number of people, maybe only get together with one family and mask inside. My thought is if we really want to make a difference, the only tool that we have is masking. And so we should put on those masks. It's not the ideal situation if you're getting together with family, you love your family, but it is a great tool, and we know it slows the spread of infectious disease, including COVID.
Okay. Thank you.
And that appears to end our questions from reporters.
Yeah, thanks, Greg. Yeah, and we're look, internally with my family, I can tell you that we're thinking about celebrating Thanksgiving in my mom's garage. My mom is in her 80s, and we want to keep her safe, and we will be masking. We have to be, but we're not going in her house. And so that's a very quick off the cuff idea, but we want to make sure that